So, good afternoon. I am Dr. Sandeep Govil, and today we learn the INI-CET previous year's questions. I welcome you to the Unacademy, and so welcome Ritvik. So, thank you so much for joining us. And today we talk about the topics which is to be covered in the INI-CET, and also the take up the INI-CET previous year's question. Now, I have been teaching psychiatry for last 20 years, and this is today's last offer. So today is the last day, and since today the prices are changing, so I would say join us today to get the flat 25% off for the NEET PG vital record lecture for free, along with one free physical notes, first part 1 on 6 months and above subscription. So that's buy 6 months get 1 month free, buy 9 months get 2 months free. Good afternoon, Dr. Muthu. And that's so after a long time the YouTube session is happening, and exciting it is to conduct. So 12 months it's a 3 months free, and 24 months it's a 6 months free. 36 months it's a 12-month free extension. So the topics to be learned for the INI-CET, which are being commonly asked, is the detailed MMSC, suicide risk, the DSM, the Diagnostic Statistical Manual of America, the brief about the ICD, electric shock, and latest in psychiatry, the RTMS. Also, they have been after asking the Wernicke-Korsakoff syndrome, because that's technically means less read, so we all tend to be confused more into it. Otherwise, nothing much to be different. Okay. The latest in psychiatry, the anti-craving drug and the lithium has been the limelight, as you all know. For the last 2-3 years, it has been asked in multiple platform, multiple directions. And the concept of the 6 types of bipolar, therapies of OCD and the phobia. So that's all we must know for the INI-CET, other than the schizophrenia and a depression. That's nothing to say, but these are the currently in the last 2-3 years they have been asking this much. So that is the so let's do the question, and that's the what are the okay B. What are the most common disorder when it comes to the, so it is the eating disorder is the most common. Well done, welcome Dr. Yashashvi, and well done. Okay. So we just learned that the mental health conditions which are more common in the males are the autism, early onset schizophrenia, antisocial personality disorder, oppositional defiant disorder, and so on. In the women, the disorders which are common are the depression, anxiety, phobia, and so on. So these are the common disorders we see occurring in the females. Okay. So this is the list. This is the list we have. The anorexia nervosa, bulimia nervosa, and the binge eating disorders. So 9 out of 1000 in women and 3 into 1000, and that's a bulimia nervosa is 15 into the. So bulimia nervosa and anorexia nervosa remain the limelight of the topics of this average age is around this same. We may also be asked that we must know that the anorexia nervosa has been categorized based on the BMI. BMI less than 17 kilogram per meter square is the anorexia nervosa, and bulimia nervosa is categorized into severity based on the number of the inappropriate compensatory mechanism per week. Number of the inappropriate compensatory mechanism per week. ठीक है डॉक्टर साहब. There are some issues in setting. I think you're able to see it. Okay. Now the percentage of death in sound is okay, Doctor sir? Okay. So percentage of death, suicidal death in this schizophrenia include the 10%. Okay, yes. So normally we know that the most common cause of suicide is depression. And the most common phase of depression for suicide is the depression in recovery. We call it as a paradoxical suicide. We call it as a paradoxical suicide. The paradox here is that the depression is improving, but the person commits suicide. And we must appreciate that So suicide reason for is the despair and depression due to the illness, or in response to the command hallucination or the persecutory delusion. It is because of the maybe depression in the schizophrenia that I become schizophrenic, it's a bad illness, what will happen to the life, or it is because of the command hallucination or the persecutory delusions. Also, we must appreciate the three things that I would like to ask and tell you that the antidepressant with anti-suicidal property is the TCA. Mood stabilizer with anti-suicidal property is the lithium. Antipsychotic, so that could be a latest question with the clozapine. So suicide remain the major avenue to learn. Well done, Dr. Bhargavi, Dr. Muthu. Yes. Clozapine, yes. So basically that's the three answer we must remember for the suicide. And we all remember that the chemical responsible for suicide is the serotonin. Chemical responsible is the serotonin. Okay. Now the MMSC score. MMSC we all know is a mini mental status examination. It's a bedside test for the memories, and the total score of this is the 30, and cutoff score is 24. Anybody scoring less than 24 will be called as the dementia. Recall, no doubt sir. Recall नहीं है, नहीं. So it's a place orientation. That's how we have to remember it. We have to be very clear about it. It's a place orientation. Sorry, not this. Oh my god. So we'll just have a look at this. So it's a 5, it taps the 5 area of the cognitive function, namely orientation, registration, attention, calculation, recall and language. So registration and recall, attention and calculation and language, and the orientation. It's a, see, orientation time is the 5, place is the 5, and spelling the word backward or serial 7s. Recall is 3, registration is, repetition is only 1. So registration, recall is 3. So 3 is the recall and registration. 3 words will tell, and that will be the point. So orientation to the time, place is the maximum score, other than the complex command. Not a paranoid symptom. So though not very logical MCQ, but in INI-CET they can ask you this. So not a paranoid symptom. So paranoid in English we all mean that the suspiciousness, but in psychiatry it's a umbrella term for all delusions. It's an umbrella term for all delusion. So whether it's a delusion of persecution, infidelity or grandeur, it will be a paranoid set. Thought alienation, though it's a disorder of the thought possession, so it is not been categorized as a paranoid symptom. Well done, Dr. Kshitij, Dr. Yashashvi and Dr. Murthu. So that's a different type of schizophrenia. The important point about schizophrenia, we would also know that the term like paranoid, catatonic, disorganized, undifferentiated, residual, they all have gone. ये अब चला गया है. We all must remember, as per DSM-5 and ICD-11, all named schizophrenia are now obsolete. We only have the schizophrenia. So no paranoid, no residual, no undifferentiated. We only have the schizophrenia and the catatonia. We only have the schizophrenia and catatonia. ठीक है डॉक्टर साहब. Okay. So, and the importance of the, and what is schizophrenia? Two positive plus 1 negative or 2 negative or 3 positive symptom for 6 months as per DSM-5 and 1 month as per the ICD-11 is it's a schizophrenia. So that is the importance of the positive and negative symptom. So we may have an MCQ latest asked that the concept of the positive and negative symptom been given by. So we must know that the Nancy Andreasen given somebody having extra is a positive symptom and it's a negative symptom. So anything extra than a normal man is a positive symptom. What all we have, they don't have is a negative symptom. So we all have a motivation to work. We all have a socialization. We all do language, talk. We all have attention to focus. Anybody lagging that will be called as the negative symptom. Okay. So delusion, hallucination will be a positive symptom. So we must now, because we have been asked MCQs about the Emil Kraepelin who given the concept of dementia praecox. We have been asked MCQs about the Bloiler who coined the term schizophrenia. But now I think the latest first rank symptom Schneider has been the popular MCQs. But now the latest MCQ I could foresee is the Nancy Andreasen name, because she is the lady in 1980 given the positive negative symptoms. So now the whole psychiatry, whole schizophrenia is focused on the positive negative symptom only. So that could be a name they could ask you, that the concept of the positive negative symptom and cognitive symptom of schizophrenia has been given by Nancy Andreasen. Emil Kraepelin dementia praecox. Eugene Bloiler coined the term schizophrenia. Schneider first rank symptom of schizophrenia and positive negative given by Nancy Andreasen. Now the visual hallucinations are associated with. So that's also interesting MCQ. Visual hallucination in psychiatry we all know indicate the organicity. But in dementia, they let us to almost need a diagnosis. So which is the dementia where we see the visual hallucination as a most? FTD, PSP or Lewy body dementia. Nahi Dr. FTD also we have, but the hallmark or the presentation is the Lewy body dementia. देखिए, it is the second most form of the dementia after the dementia of the Alzheimer's type. Visual hallucination occur more than 20% of the patient diagnosed with dementia of Lewy body. Now the prominent symptoms are not the memory lapses. Prominent symptoms are the Parkinsonian symptom, visual hallucination and fluctuating memory. So in the morning or the one day the memory is totally okay, next day the morning is totally gone. So that's the hallmark we see. Presence of the movement disorder with visual hallucination with cognitive fluctuation is a dementia of Lewy body type. Well done, Dr. Ashi. Thank you for joining with us at such a Sunday afternoon. And Varnacillin though is out of the country now, but is a good drug which can be used for the nicotine de-addiction. So it is acting as a partial agonist on the nicotine receptors. Treatment is given for 24 weeks. And it is to be given, so it's a nicotine addiction में use होती है. अभी currently not been available. Acting on the alpha 4 beta 2 receptors. And it is a partial agonist, and the set a date, begin vernaceline before that date, and quit smoking between day 8 and day 35 of the treatment. It has a initiation program is like that. 0.5 milligram to start with, then 0.5 milligram blood BD, then 1 mg BD. If quitting is successful after 12 weeks, then continue for another 12 weeks 1 mg 12 hourly. So that is the dose we must remember. But currently been not been there. So side effects are important because they took a toll, and it's a suicidal ideation and attempt that lead to the complete suicide also, that lead to the removal of this drug from the Indian market. So it can lead to psychosis, depression, and even this depressive cognition. ठीक है डॉक्टर साहब. So question was that false क्या है? So suicidal can be a side effect, depression can be a side effect, acting as a partial agonist on the nicotine receptors, but treatment to be given for 6 weeks only. It is true for 12 weeks, 12 plus 2. Now, person hearing a voices before falling asleep. History of falls in a day, time, sleep attack. So narcolepsy is one topic which has been uplifted in the INI-CET, PGI, NEET PG like anything. So from one level to another level, it has keep on being MCQ asked. So it's a schizophrenia. No. All say Adnan Saab, Kshitij ji. So well done, all settled for the A. It's a narcolepsy. We know it's a pentad of the sleep attack, sleep paralysis, called as the cataplexy. Sleep attack, sleep paralysis, hypnagogic and hypnopompic hallucination. Hypnagogic and hypnopompic hallucination, and the abnormal REM intrusion in EEG. So there is a REM will come in the EEG. So hypnopompic, hypnagogic. Gogic is while going to sleep. Pompic is while waking up from sleep. What are the other one symptom? Sleep attack, sleep paralysis, cataplexy. वो अलग अलग चीज है. Cataplexy is the sudden break in the tone of the muscles. So that's not the okay. Sleep attack, sleep paralysis, cataplexy, hypnagogic sudden break in the tone of the muscle is being called as the cataplexy. They have asked you another question that so any emotional outburst leads to fall. That's a cataplexy. ठीक है डॉक्टर साहब. So it's a long-term neurological disorder with a hypersomnia, excessive daytime sleepiness lasting from seconds to minutes. That's also important. That's also an MCQ. Ki maximum it is 20 minutes. Maximum 20 minutes and may occur at any time. 70% of the narcolepsy people experience episodes of sudden loss of muscle strength, and spells can be brought about by the, so that's a Same MCQ has been asked in the INI-CET, if you remember, that on the sudden outburst there is a crying or this thing, the person had a episode, so falls down, that's a cataplexy, a symptom of cataplexy, sleep paralysis, sleep attack, and excessive daytime sleepiness. Okay. Now, how would a diagnosis of agoraphobia be made? I think it is A, we should say. See, we know in English that by definition, yes, it's B. Agoraphobia is the fear of open spaces. But in psychiatry, please mind, agoraphobia is fear of places from where easy escape is not possible. It could be an open space, it could be a closed space, any space, it will be called as the agoraphobia. It is of two types: without panic attack, with panic attack. So with or without panic attack. Okay. But in English, so in psychiatry, whether it is a closed atmosphere, whether it is a lift, whether it is anything, you have to make a diagnosis of agoraphobia. In English language, we have words like kleptophobia, lellophobia, lysophobia, so many things. Open spaces, this closed spaces, claustrophobia, being locked in. Dogs is cynophobia, fear of drinking is dipsophobia. So, gamophobia is the fear of marriage, writing is graphophobia, and woman is gynophobia. So, different types, heliophobia, different names. So, n number of names for different type of a phobia specific, but for the place phobia, it will be the agoraphobia. Now, cannabis for years, marijuana for years have been learned and taught as a drug with the previously it was called as a no physical withdrawal, only the social withdrawal. Only social psychological, only the psychological withdrawal. Better we say the dependence. No physical dependence, only previously. But now, as per the latest DSM-5 and ICD-11, we have learned that cannabis or marijuana can lead to the physical symptom, and irritability is the more common. Poor sleep, poor appetite, and irritability, yawning can be there, and these are all the low motivation. They are all the side effect of the withdrawal effect of the marijuana. Okay. Mild dependence may experience minor physical and psychological discomfort such as restlessness and headaches. Severe may got the sweating, fever, chills and hallucination. But otherwise it's a irritability. So this is what is a list of the physical and the psychological withdrawal. Stomach discomfort, sweating, tremors, headache, irritability and depression, but the most common is the irritability. Okay. So that's all about the cannabis. So withdrawal timelines. So these are all the, we know cannabis is a drug with the flashback phenomena. You take cannabis today, enjoy the pleasure of yes. Yes, Dr. S. In the previous question, the panic attack, we can say that is deciding the, when left alone there is a panic attack, we can still classify as a agoraphobia. So that is also can be the one answer. If it is two, then it is A and B. But if it has to choose one, then I think we have to go for a B. But with the caution that agoraphobia does not indicate open space in psychiatry. That is only in the English language we have a agoraphobia for the open spaces. So even if I ask you that person is fearful of moving in lift of a high rise building, diagnosis is, so we know that closed is a lift is a small place, it is a closed place, so we have to have a claustrophobia. And high rise is a acrophobia in English language. But as per psychiatry, diagnosis is agoraphobia. As per English, it is one is the, as per English, one is the acrophobia, the fear of heights. Other is the claustrophobia. ठीक है डॉक्टर साहब? Okay. So that's all about the fear and the cannabis and this. Not a side effect of lithium. So lithium has been a limelight, we all have learned, been asked many times. The levels have to be done after 5 days, within 12 hours. So these are all the questions. And we have learned the side effect of lithium and the toxicity of the lithium. More than 1.5 milliequivalent usually is the toxicity. Okay. Leukopenia, very good. It's a leukopenia. Yes. Side effect are the hypothyroidism, diabetes insipidus, hypothyroidism, diabetes insipidus, and the fine tremors. In toxicity, we have a coarse tremors. We know it's a neurotoxic drug. Lithium is a neurotoxic drug. It has coarse tremors, brisk reflexes, ataxia, nystagmus, seizures, coma, and the death. So polyuria we can have because of diabetes insipidus, hypothyroidism, but we usually don't have the leukopenia. In fact, we know it is a drug of choice for some leukemias. Given in some leukemias to boost up the lymphatic synthesis, neutrophilic synthesis करने के लिए काम आता है. It causes the leukocytosis. ठीक है डॉक्टर साहब. So hypercalcemia नहीं होगा. We'll say leukopenia because leukopenia side effect of the lithium is the hyper WBC count. It's a leukocytosis, so that can't be the side effect. So these are all the side effect. Okay. So see, one question has been asked in multiple platform in a multiple way, but question and the topic remain the same. Let's see this question. All of the following are correctly matched. Most common side effect except. It's a bupropion plus. Metazapine can lead to the akathisia. It can lead to sedation. Clozapine can lead to the क्लोजापिन तो इंक्रीज सलाइवेशन करती है. दो जवाब हैं इसके. bupropion is a bupropion and metazapine no sexual side effect. So remember we have been asked that the commonest side effect of the SSRI or the antidepressant is the sexual dysfunction. It delays the ejaculation, which has been commonly represented as a circling side effect. But we need a drug which is a side effect neutral, which does not cause this sexual side effect. So that the drugs are the bupropion and the metazapine. So that is a straightforward MCQ. Wet pillow symptom. Yes, very good. So दो जवाब होगा इसके A and the clozapine. We know the most common side effect is the and salivation. ठीक है जी. Now true about trichotillomania. We know that to set fire, it's a pyromania. Pyromania. It is an impulse control disorder. Currently placed with so now we no more learn it as a impulse control disorder. The pathological gambling is being learned and taught along with the addiction disorder, because this is also a disorder of the reward and the addiction. So still thing is the kleptomania. All of the following are associated with a better prognosis except. बताइए डॉक्टर साहब. Late onset, somebody married, acute onset, नेगेटिव सिम्टम नहीं है डॉक्टर साहब. नेगेटिव सिम्टम इज अ पुअर प्रोग्नोसिस. So we just have a learn of revision of a good and a in psychiatry. Good and the poor prognosis. So we just say it's a acute onset, usually after a precipitating factor, predominantly positive symptom, no family history, some of my emotions are being preserved, no CT scan MRI finding, somebody married, female gender, and late age of onset. That is also an MCQ. What is late age of onset? After the 45 years of age, that is the late age of onset. So that is the, so C is the answer. So positive symptom is a good prognosis, negative symptom is a poor prognosis. So gradual onset. As such, there is no precipitating factor. Somebody will say that some problem is there from very beginning, but now it has become more. So no precipitating factor, predominantly negative symptom, family history positive. When I tell you negative symptom predominant, that means emotions totally gone. There are some CT scan MRI finding. Somebody having a schizoid personality beforehand. And presence of the soft neurological signs. Presence of the soft neurological signs is a poor prognosis. So that's a complete table for the, it's a soft neurological signs. Okay. ठीक है डॉक्टर साहब, done. Now transitional object is seen between the ages of. So these are all the psychological, theories. The Jean Piaget psychological theories. He said there is a life, in the life of a child comes the transitional object, and the first is the sensory motor stage. And completion of this is by the object permanence. So the child will believe then the mother is even not there. So object permanence. So even the mother is not there, the child will know that the mother is somewhere near and shall be coming back. Okay. Okay. I have to see this. Just a moment. Now 2 years for the dead people will not come back. See, the age of the thanatophobia is around 7 years of age. Thanatophobia is at 8 years of age. So fear of death comes here. So that is the age where the person comes to know, child comes to know that this time the cognition developed to this level that if somebody goes by death, then will not come back. So thanatophobia is between, you can say 7 years, 8 years, both shall be the correct answer. Okay. Now that is the very, very important question I would ask. Now we all know that suicide is going to be the most common cause of death very soon. In the global world, the suicide will take over the cardiovascular deaths, the brain hemorrhage death and accidental death very, very soon. We must know that what is the factor most important. That's why the not is the or none. इसका जवाब तो none है. We must assess everything. But among the four, अगर मैं पूछूं आपसे, among the hopelessness, insomnia, social isolation and substance abuse, which is the most factor decide the suicidal potency? That is the hopelessness. Cognition most strongly associated with suicide is the among the hopelessness, helplessness, worthlessness and many guilt and everything. It's a hopelessness which is the more dangerous. And social isolation, insomnia, substance abuse, they all will lead to the social isolation has also been assessed. ठीक है राट साहब. So we just go for the individual and risk factors are previous attempt of suicide, major physical illnesses, and here the anxiety disorder and other substance use disorder. ठीक है राट साहब. Yes, among the Beck's triad, Aaron-Beck triads of the hopelessness, helplessness, worthlessness, it is the hopelessness that decide it most. So, psychiatric symptom, the anhedonia, the self-hate or the panic, anxiety, and as I tell you, command hallucination and the hopelessness. Okay. Now we must also remember the protective factors: life satisfaction, social support, sense of belongingness, coping skills, and so on. Now that's again an important MCQ. The patient on treatment, we know that overdose of TCA causes death by cardiac arrhythmia. And before I die, we know the TCA actually slows the cardiac conduction. That is also an MCQ. Now before I die, you have two options to help me. You can help me twice. That there will be a widening of QRS complex. Treatment is sodium bicarbonate. There is a QTC prolongation. DC shock or cardioversion. So we all must remember that. This question has been asked in many times, many ways. So TCAs, they cause the dryness of the mouth, constipation, hypotension, urinary frequency, sedation, so bradycardia, decreased sweating and salivation, that leads to the illness. Now, adjustment disorder, false is very beautiful question to understand what is the adjustment disorder. फॉल्स इसमें दो बातें हैं, ए एंड डी. वी नो, या डी तो पक्का ही है, वी कैन से ए ऑल्सो. वी नो इट्स अ इलनेस which should start within 2 weeks to 3 months stressful event and resolve by its own within 6 months. It is the following type: depressive type, anxiety type, conduct type. What do you mean by type? Symptoms are sub-syndromal. So if we have to choose one, the answer should be a D, because it is not a permanent condition. Pharmacotherapy usually we don't give. We only try to manage with the psychotherapy and the group therapy. But if it is two choice, you may have to go for a and D. But not every time we use the pharmacotherapy. We have, as the name suggests, it's a self-limiting illness with the acute stress में और इसमें. डॉक्टर साहब ये गलती हुआ है हमसे, जगह नहीं छोड़ा है. ओके, कहीं भी जगह नहीं है. See, we learn 3 things: acute stress, grief, and adjustment disorder. Acute stress, or we can say PTSD together, because we know less than 1 month is acute stress, more than 1 month is a PTSD. We all know that this happens after the objectively high stress. This is a subjective perception of stress. Grief is after death of a loved one. Here the symptom profile अलग है डॉक्टर साहब. Repetition of the event again and again in the dreams, flashbacks, illusions, some emotional reaction, and we have the avoidance. Here is a shock and denial. Shock and denial, distress, and detachment. So symptom profile is different. Shock and denial. Here are depressive type. So stress may not be appearing to be a stress to some, and the sub-syndromal depressive symptom, sub-syndromal anxiety symptom, they never fulfill the criteria of a depression, but it's a sub-syndromal, thereby managing easily by the psychotherapy and rarely requiring the medications. So I think that's clear. Differentiation and the MCQ they ask you to appreciate is the mainly the objectively high stress. It will lead to a stress in almost everybody, and it's a subjective perception of the stress. ठीक है राज sir? So that's all about that question. True statement about delirium include. Delirium, we all know it's a sudden onset and the consciousness is not clear, and it's a true statement is there is a decreased attention. It is reversible usually. Delirium is you treat the cause, it will be reversible. So answer is D, very good. But the latest question can also be the chemical responsible for delirium. Acetylcholine. So delirium happens because of lack of the choline in the brain. So somehow the choline get affected, leading to the delirium. So that's why it's not an insidious onset. Delirium is a acute confusional state. So delirium by name is English is a acute confusional state. Subjective objective is I tell you, now somebody has seen a car bomb blast. His whole family blown off in air in front of his own eyes. You tell this example to 1,000 people. Out of 1,000, 999 will say, Dad Saab, whatever experience by him, had I seen my family blown off in air in front of my own eyes, I could have reacted in the same manner. So out of 1,000, 999 will react in a same situation. Subjective perception of the stress, I tell you, the MCQ asks that wife come to know about the affair of husband and now she attempting suicide. She become very terrified, troubled, not able to sleep, and she attempted suicide. And I that as a question as a adjustment disorder because there is no other symptom of depression. She was only having some crying spells and some sleeping issues. It's a subsyndromal depressive symptom. That stress is a subjectively perception of the stress. For example, so for husband having an affair, wife attempting suicide, other will say let him go to hell. If he is not bothered about me, why should I? Others say, yeah, I know about their affair for about 2 months, but I was just arranging for the pistol. I'm just arranging for the pistol. The moment I come to know, I'll just kill them. So, knowing the husband affair has 3 sequence. One is the depression or the adjustment disorder. Other could be a severe fight. Other could be a murder, or other could be a let him go to hell. Okay. So that's a subjective perception of the stress. How I take up the stress. So OCD has been living area. So we must know that OCD colostrum is not involved. It's a pandas, you must remember. Pediatric onset neuropsychiatric disorder associated with the streptococcal infection. So they ask you the streptococcal. Yes, because that is also an MCQ. Pandas mein it is staphylo or strepto. It's a streptococcus. Pediatric onset neuropsychiatric disorder associated with the streptococcal infection. Pandas is for the OCD we use. So the various areas involved is the orbitofrontal cortex, anterior cingulate cortex, head of the caudate nucleus, and so on. So now Wernicke-Korsakoff syndrome in chronic alcoholic, following symptom except. That's a बहुत ही simple लॉलीपॉप सवाल है. इफ यू नो द बेसिक कंसेप्ट ऑफ द वर्निकेज एंड कोर्सोकोव्स. इन कोर्सोकोव साइकोसिस देयर इज अ लॉस ऑफ recent memory loss plus confabulation. Well done, it's a B. So we may have ataxia, we may have a nystagmus, confabulation, but there is an anterograde amnesia, more of a anterograde amnesia. So that's a acute reaction to severe thiamine deficiency, commonest cause being the alcohol. Other can be the uremia and the excessive vomiting in the pregnancy. Ocular signs are nystagmus, ophthalmoplegia, pupillary irregularities, and disorientation, confusion, recent memory disturbances. Please see. Okay, apathy, ataxia, and hemorrhage in the mammillary body and the midbrain. So, neuronal degeneration and the hemorrhage in the thalamus, hypothalamus and the mammillary body. ठीक है डॉक्टर साहब. So, with this we wind up here with JIPMER questions. Too much to do. But we thank you so much for joining with us and enjoying the psychiatry with us. And we are conducting our special classes on every Monday and Friday. This Monday we might not be able to do, but Friday we shall cover up the substance use, and next Monday we cover up the. So special classes are there, and I request today is the last day for 25% discount on an academy. So it's a live class, discussion class, along with recorded lectures are available. Special class every Monday and Friday. In psychiatry at least 10:30 p.m. to 11:30 p.m. This Monday not able to do. Friday we shall cover up the substance use disorders. But again I thank you so much for being with us and enjoying the psychiatry with us. Thank you so much. All the very best.